Hi guys, it's Wednesday, March 18th, 2020, and hold on because I cannot breathe. Okay, maybe that'll help. Clearly, probably not with my voice though. Okay, so, a little bit of update from yesterday. You would not believe the hoops I have to jump through to get this all figured out. If you hear anything, I did take down the clock so you're not hearing the tick, 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 tick from that. What you do hear, other than my kids and Brian, is my humidifier that is running 24/7 now. You're going to even see the smoke from steam from it. So I can actually breathe while I'm kind of doing stuff. So let's jump right into it. First of all, I want to start with this. I just got information. I'm not going out into public. My family, however, my kids and Brian, other than Brian, are not going out into public either. My mom and both of my older brothers live with my parents. So my older brother went to the store today, a local grocery store, a smaller one, one different than the one that I shop with. We have two in our town, so I shop at one, he shops at the other. And I talked to my mother today. This is what I'm being told per the situation currently here. Food shelves are nearly empty. There is no milk. There are no eggs. There's no bread. There's barely any meat left. There are still some canned foods, no dry foods. My brother ended up taking the last of some frozen foods that were in there. Essentially, he said there wasn't very much produce left, which most people don't buy produce from there anyway, unless they absolutely have to, because it's not the freshest produce. That was the situation today. So I asked him, did you speak to a store manager? What's going on with the trucks? Those kind of things. They were supposed to receive a truck yesterday morning, very early before the store opened. And they didn't receive their truck. It is Wednesday afternoon. It is 2:24 p.m. here. And no truck still. He had just gotten back. I just got off the phone with him. He had just got back from the store and there still was no truck. Store manager, is not sure when the truck is going to be coming in. So it's happening. It's happening everywhere. Panic buying, panic stocking. Not sure when the truck shipments are going to be in. So that's a little bit of an update, firsthand information from that, and store managers who are saying they don't know when they're going to receive their truck. So this morning, Brian told me I should contact the CDC and see what they say about doing a test. Let's hop over to the website, take a look first at what the CDC has been recommending in regards to this Karachi virus. So this is their direct website, their direct recommendations. Call your doctor if you think you have been exposed to Karachi and develop a fever and symptoms such as cough or difficulty breathing. Call your healthcare provider for medical advice, which I did. If you're in close contact with someone with Karachi, or you're a resident in a community where there is ongoing spread of Karachi and develop symptoms, bless you! Sorry, Brian was sneezing. And develop, oh no, he might have it too. Actually, I think he's a carrier and doesn't have symptoms, but that's just my opinion. And develop symptoms of Karachi, call your healthcare provider and tell them about your symptoms and your exposure. They will decide whether you need to be tested, but keep in mind that there is no treatment, and people who are mentally ill may be able to isolate, care for themselves at home. And then it goes on to talk about if you're at serious risk, if you're very sick, and information for healthcare professionals. Okay. So, let me jump back here and just say I did all of those things. I did exactly what I was supposed to be doing. I do feel a little bit better today. I've had a little bit more energy. It hasn't been really knocking me down when I'm up and doing things around the house and those kind of things. So, am I starting to see the tail end of this after day 5? Maybe. Still have it all here, still have it here, I'm on the inhaler, still coughing, those kind of things. But let's hope I'm going in the right direction. All right, let's take a look at this also. I thought this was important. I pulled this up as well. If you are sick with Karachi or expect, suspect, inspect, whatever, that you are infected with the virus that causes Karachi, you should take steps to help prevent the disease from spreading to people in your home and community. If you think you have been exposed to Karachi and develop a fever and symptoms such as cough or difficulty breathing, call your healthcare provider for medical advice. And so on and so forth. So just more of the same crap that they had put on the other page. One of the links that you can click on there. Yeah, did all that. Contacted CDC. I was on hold for 57 minutes before I spoke to somebody who said, you did what you were supposed to do. Call the New York State Department of Health. Okay. What's the number? Get the number. Call New York State Department of Health. On hold for 30 minutes. Now, before I discuss my communications with the New York State Department of Health and what they have stated, let me point this out so that you kind of understand, for those of you who do not live in New York State. Why is my computer not? Oh, because it wants to bring up a stupid little pop-up. Of course, everything's got to have pop-ups. Where did my map go? All right, let me start with this for you on this United States cases map that we have currently. Yes, that's my email. Sorry, Brian, we're trying to set up a telecommunications conference for one of the kids here, so got a lot going on as always. Okay, so this is the current numbers. Supposedly, this is supposed to be live updated information, but I don't think that it's accurate. But this is just what I found per livescience.com on the update. So this is where we're at right now. Look at this number, guys. As of yesterday, we were up to a little over 500, and now we're at this. Is it because they're doing more testing? Probably. Whatever. Anyway, let me click on this. If it'll actually load, would be, yep. Can you work with me here, or you don't want to work with me? I'm trying to make you guys understand. Oh, this is so frustrating. Let me put you guys back on here while I try to figure out why my computer wants to not work and I'm supposed to do video conferencing for everything. Good luck with that. This literally worked earlier, so I'm not really sure what's going on. Oh, it's so frustrating. This is frustrating me so bad. You're supposed to be able to click on the... You're supposed to be able to click on the state so that you can bring it up and you can go county by county. But clearly it's not going to let me do that, so we'll just skip on that part. But what I was going to show you is that I'm down here, and Brian's work is up here, and he travels across the entire county and stops at all of those stores and stuff on his way to and from work to go from here to here. Kind of frustrating, I can't show you, but anyway. So I contact New York State Department of Health. New York State Department of Health official asks for all of my symptoms, asks if I have any underlying medical conditions. I tell him all that kind of stuff. And he proceeds to tell me, I don't understand why they didn't test you for the flu. I said, I agree with you 100%. They should have tested me for the flu first. Ruled that out before they started throwing this Karachi at me. Sticking me in voluntary quarantine, blah, blah, blah. Regardless of whether you have one virus or the next, you shouldn't be out in public and spreading your germs when you don't feel good, and for a good reason. Anyway, that's besides the point. That's just common sense, but clearly that eludes 95% of the general public. Yeah, that's just putting it nicely. Anyway, so he tells me that because of my underlying medical conditions and the way that I sound on the phone when I'm speaking to him and the coughing that I have going on, that he's going to make it a top priority that they figure out a way that I can be tested for this, because I need to be tested for this so they can have accurate information for reporting purposes and things like that, regardless of it, whether it comes to light that I have this and I need to be quarantined. My whole family needs to be quarantined. We need to be in contact with the people that we've been in contact with, and they need to do testing on those people. Regardless of that, he said it's important for, reporting purposes so they have the most accurate information that they could potentially have in this massive crisis to do their thing and for future uses and that kind of stuff. Whatever I can do to do my part. I hope I don't have it. If I do have it, it's whatever. I'm already home anyway, so it's not really going to change my life all that much. But it would be nice to know. And I did have a couple of people that were like, oh, it's not going to matter if you have it or don't have it. There's no cure for it. You can't make a difference. Blah, blah, blah. I'm doing a video. Can you wait 5 seconds until I'm done? Thank you very much. It's every day, all day long. It's so frustrating when I'm trying to do anything. Anyway, so regardless of whether I have it or not, it's, am I infecting other people? Should I be doing more precautionary measures? Should all of these things be going on? I don't care if I have it. I'm clearly not going to be hospitalized, hopefully, and all that kind of stuff. And my kids and Brian should be okay if they end up contracting or getting symptoms. But I can't say that for the other people that we've come in contact with. And that's what's important about this. It's not about me. It's not about what's going to happen to me. I don't care. I mean, I do care. I don't want to pass away or anything. But it's about protecting other people. So you need to put everything else that has to do with you aside. And you need to think about the bigger picture. And nobody's doing that. And, I read these comments and I'm like, listen, I don't care if I have it, but I need to know so they can stop Brian from going to work and spreading it to 5 other counties, right? Common sense. Again, eludes 95% of the American public. Now that I've done with my rant, let's continue on, shall we? This. All local governments reducing workforce by at least 50%. Non-essential state workers are working from home, waiving all park fees. This is what got me. Testing is free for eligible New Yorkers as ordered by a healthcare provider. Okay. Your local health department is your community contact. Let's click on this and see where it leads to. Oh, this is where my map is. That's right. Here we go. So here's what I can show you. This is where I live. Okay. This is where Brian works. So he's going to all of these stores, all of these businesses, a majority of the time on his way to and from work to here, and he could potentially be having this and spreading it all along here. They already have a ton of reported cases. They even have at least 1 death, potentially maybe more. I haven't looked at the newest information. Supposedly we have nothing here. There are cases here. There are cases here. There are cases here. There are cases here. I think no cases here. This is where my son lives. So he lives right around here. I don't think there's any cases here. No, haven't heard of that. No, haven't heard of that. Think I've heard about some cases there. Not any cases in those places. So kind of like just this general area, like right here, including this, and there, I think. So all around here is where they have some cases. Okay. So with that being said, I'm currently waiting on the New York State Department of Health to call me back with information on how I will be tested for the Karachi. Haven't heard anything as of yet. Let me check my cell phone here and see when I called. Let me see. Hold on. Recent. I contacted them 3 hours ago. I haven't heard anything yet. Don't know. Not sure what's going to happen. I'll keep you guys updated because these are things that you shouldn't have to go through this much trouble. If you are trying to prevent the spread and prevent family members that have to leave the house because you're not under a mandatory quarantine and are potential carriers of this and are spreading it continuously because you don't know, with somebody in your house being sick and not being able to be tested because you have to jump through 50 different hoops and stay on the phone for hours on end trying to get even somebody to pay attention and do anything. That's just where I'm at. So, thought I would update you guys. I'm gonna go figure out this telecommunications thing for Bree so she can talk to the people that she needs to talk to, and I'm going to be spending the rest of my day with this humidifier literally up my nose. I may put my face right over it. I'm not even kidding. So that's all I've got for you guys today. Let me know what's going on in your area if you've heard anything, especially about the grocery store shortages, trucks not coming in, trucks being postponed, those kind of things. That's important information we need to keep an eye on because it's just going to continue to get worse as this continues on. So let me bring back my catchphrase. If you're having a good day or you're having a bad day, it doesn't matter. Everything happens for a reason. We'll get through whatever it is that we're experiencing. We need to be prepared. We need to be vigilant. And we need to be keeping our eyes wide open and be paying attention to our surroundings and the things that are going on around us and reporting things that are happening so we know what's going on, because we're not being told the whole truth, as with anything. So leave your comments, questions, concerns, frustrations, criticisms, whatever you want in the comments. And like I said, I won't be doing a video tomorrow. I will be doing a live stream. So I'm going to gather my information today on that. I've already started bookmarking some websites and things to share with you guys and information that's been out there as far as that goes. And we'll go from there. So hope everybody enjoys the rest of your Wednesday. And I'll catch you on the flip side.